Today, I'm going to give you a little dental hygiene history lesson. Whether you're a practicing hygienist or thinking of becoming one, it's always nice to know a little history about the profession. Did you know that oral hygiene tools have been found in archaeological digs throughout the world, dating back to prehistoric times? These include bird feathers, animal bones, and porcupine quills. As a matter of fact, the first known toothbrush was made around 3000 BC. Yep, it was a twig with a frayed end called a chew stick. As far as toothpaste is concerned, ancient Greeks and Romans are known to have used toothpaste made from crushed bones and oyster shells. They even had special ingredients added, like powdered charcoal and tree bark for flavor and fresh breath. Anthropologists have found evidence that people around that time used dental floss too. Not exactly as we know it today, though. Their version of dental floss consisted primarily of thin pointed sticks for interdental cleaning. Just goes to show you that people have been inventing ways to keep their teeth clean and sparkly for thousands of years. And although their attempts were pretty good, what they really needed to maintain optimal oral health was a dental hygienist to help show them how. Well, thousands of years later, the role of the dental hygienist as we know it today was born. In a field largely dominated by women, it's interesting to know that the role of a dental hygienist was conceived and developed by a man. As a Connecticut dentist in the early 1900s, Dr. Alfred Fones was concerned about the number of patients losing their teeth from cavities and periodontal disease. Convinced that the removal of plaque and calculus from the surfaces of teeth could reduce or prevent tooth loss, he began a crusade to persuade others in the dental and medical fields that dental disease could be prevented. In 1906, Dr. Fones trained Irene Newman to be the first dental hygienist in the world. He taught her how to provide preventative dental cleansings and prophylaxis to his patients. He believed hygienists could be trained to provide preventative services, allowing more time for the dentist to perform more complex procedures. The results were so successful that in 1913, with $46,000 of his own money and donations from other dentists, he opened the Fones School of Dental Hygiene in Bridgeport, Connecticut. 34 women were accepted and enrolled into the first class, and courses include tooth anatomy, histology, and clinical practice. By the second year, 16 dental chairs were brought into the classroom so the hygiene students could apply what they learned by performing cleanings on actual patients. The first class graduated and was ready to practice in June 1915, just 2 years after the doors opened. Nearly 100 years later, the Fones School of Dental Hygiene still operates as part of the University of Bridgeport and has paved the way for more than 230 dental hygiene schools in operation throughout North America today. Kind of interesting, right? To think that dental hygiene as a profession is nearly 100 years old.